We are faced with as a unit. I've seen quite a number of breast cancer cases. So to give you just a little bit of data on that, this year alone, and that is January and February. In February now. So this year alone, we've seen 5 cases of advanced breast cancer.
Wow.
And out of these 5 cases, 3 of them have had tissue diagnosis done elsewhere, and they were supposed to have either gone for mastectomy or chemotherapy, but due to one reason or the other, they were not able to follow through with the treatment, and they came in a very advanced stage, most of which were actually ostrated. Also, I've seen quite a number of cases where I would say it's still in the early stages, where I've screened quite a number too. The other issue is that we don't have all the screening tools.
Okay.
So some of them we have to send them probably to Tamale or somewhere to go and do maybe a mammogram, and then come back and all that. But we've screened quite a number too. Out of the ones we've screened this year, we've able to diagnose 2. Tissue diagnosis. We've taken the biopsy and have confirmed, and have actually been sent to the centers where they have the resources to take care of them. With the advanced cases, it's really concerning because this particular patient you are following up is one of those advanced cases, and her story is not really different from the stories I've heard about the other cases. And most of the challenges usually have to do with finance, because breast cancer is one of the conditions that the cost of treatment or the financial burden in treating the disease usually makes it very unbearable for patients from these rural communities, and then most of which they don't get support early enough, then the disease deteriorates. I would like to categorize it into, I want to put it into categories. Okay. So the first one is to talk about the unit as in the building, the unit, okay. The surgical unit. Okay. Some of the challenges we have here have to do with beds. Okay. So most of the beds we have cannot even be adjusted. Okay. And when we have surgical patients, some of them, you need to put them in bed that depending on what condition they have, you're able to adjust the beds and all that. And of course, the beds with the mattresses and those monitors we use on the ward. So those are some essential gadgets. Okay. That, as I said, because it's a new unit, we don't have enough of it. Okay. Which, if we get, will really be very helpful. Now, the other thing I want to talk is the facility at the facility level. At the facility level, we first of all, as for human resources, it's always a challenge. In most places, but that's also here is also quite critical. The staff strength is so bad that sometimes me as a surgeon, when I book cases, I have to take into account how many anesthetists are available, how many theater staff theater nurses I'm going to get. Okay. I have to consider all this to be in order not to book cases and end up cancelling them. Okay. So these are challenges that limit us in terms of what we can offer the patients. Okay. Beyond the hospital, as I mentioned earlier, the case that one of the reasons that we don't have a lot of facilities to support us in terms of maybe certain investigations. Like I mentioned, if we want to do a CT scan, we do not have one. We have to send them. Histopathology, usually we have to take the sample and then the patient will have to transport it. But these ones, as I said, it takes just more than the unit. We also need the expertise in those areas to be able to, facilitate some of the work.
Hope for the hopeless, faith for the faithless, and voice of the voiceless. We came to give a voice, we came to give hope, and we came to give faith to cancer patients. And that's why we are here today. You heard the medical officer in charge of the unit, you heard the cancer patient, you heard the administrator. That's why we are here to coordinate. So we are appealing to all our VSLA members, we are appealing to our partners, we are appealing to the world, we are appealing to the globe that Bole Municipal Hospital needs support. cancer patients need support. The Lodina maternity ward needs blood. You heard the maternity ward in charge when she was talking to us. If they don't get blood before they start the fasting season, it's going to be serious. So we are here to bring this up to our people, and we'll see whoever wants to do, support a cancer patient, support the cancer unit, donate to support Jaksali, to support the Bole Municipal Hospital. We are willing and ready to reach out to them. Our purpose here is to see how we can partner with any good and kind-hearted person